Hi, everybody. Welcome to our Facebook Live. And I'm here. I'm Leslie Keith with the Lipedema Project and Lipedema Simplified. And I'm here with my friend and colleague, Brenda Viola with Lympha Press. Hi, Brenda.
Hi, it's wonderful to be here. And Lympha Press is always happy to support the amazing work that you are doing because we've got the same goal, making life better for patients with lipedema and lymphedema.
Yes, thank you so much. And one of the big reasons why Brenda is here with me today is because Lympha Press is a big sponsor for our event coming up March 31, April 1 and 2. So we're going to share a little bit more about that event, but we also wanted to let everybody know about Lympha Press. And I know that our community always has lots of questions about pumps, compression pumps, and how this can help. So please, I would love it because I like to know when people are here. So put something in the chat and say
Yes, we
where
want to
you're
know
from.
who's out there
Yes,
in Facebook
yes,
land and the
yes,
interweb. Yeah. But
yes.
I have to say that my backstory, Leslyn, with Lympha Press, I've been with the company for over 10 years. And when I learned that we were indicated by the FDA for the treatment of lipedema, that's when I said, I need to find out more about this condition because it's one thing to have an indication, but does it work? So I reached out to some of the top lipedema influencers that are on social media, Patty Cornu of Lipedema Fitness, Pale Ginger Pear, she's got over 100,000 followers on Instagram, and several others. And they trialed the product. And I said, I want your candid feedback after using it. And I was learning about lipedema, and my heart went out to these wonderful women who some would diet and exercise strenuously with no results and only growing the condition. And when they came back to me, the whole goal wasn't reduction. It was primarily, and this is what I was hearing, we want reduced pain, we want increased mobility, and we don't want to get worse. And they found amazing results with Lympha Press, which gave me the confidence. I was the marketing director at that time, and it gave me the confidence to say, okay, this is a game changer for lipedema women, and we want to get involved with these communities. And so we have. So I just have to say that it wasn't well, let's market this product. We are not a company that just believes in giving you a pump, and you'll find out more about that. We understand that there's a whole lot going on. That's why we love the work that you and your organization does to support the psychosocial needs of the community and the need for a community. And the more you can have community, the better you're going to do, no matter what your challenge is.
Yes. Yeah. And talking about community, hi to Cindy and Mary who posted that they're listening to us. Thank you for doing that. Be sure to post who you are and where you're listening from. It's Ontario and Ohio so far. And post any questions as we start going through some more information about compression pumps in general and Lympha Press in particular. I know you have questions, so feel free to post. I know that you have brought something with you today, Brenda, about the 5 top reasons to use the Lympha Press. So let's take a look at that.
Oh, I love that. And the truth of the matter is not all pumps are created equal. There are differing factors that make Lympha Press unique. And that's why I always recommend to all the women that we work with, ask for Lympha Press by name, because you could get a different pump and you wouldn't necessarily get some of the features I'm going to talk about here. What you're seeing on the screen right now, and by the way, our tagline is therapy that's easy to live with. And all I know is I want my life to be easier. And I bet everybody out there watching wants their life to be easier too. It's got to be easy or it's not going to work. You're seeing our leg boots right there. Those leg sleeves really take care of the lower extremities from the knee down. That's our Optimal Plus pump. This is not what this does a great job of eliminating the fluid. It's particularly great for lymphedema patients with swollen limbs.
Mhm.
What we recommend for lipedema, you'll see in the next slide, which now this is skewed a little. This would normally be a video that you would see, but that's Angela Jones. She is a lipolymphedema patient, uses her Optimal Plus with the pantsuit. The pantsuit comes from right below the chest. It covers the abdomen all the way down to the bottom of the feet. And she slides it on her bed. She says, I shimmy in, and then she just zips it up and pushes a button. 88% of patients said LymphaPress is easy to use when we did a survey with the Center for Opinion Research at the Franklin and Marshall College. So the number one reason why patients love LymphaPress is it's easy to use. Leslyn, do you cook?
Not very much.
Me either. I stink. I'm a terrible cook. And I'm not one of those cooks like my sister. She can just throw ingredients together and it's amazing, right? Not
Yes.
me. I need to follow a recipe. If the recipe has more than 5 ingredients or uses terms I don't even understand, I say, well, I'm not making that. Can't
That's
do
right.
it. Overload in the head. And that's how I relate the LymphaPress. It is so easy. Anybody, you don't need to be technologically minded. There's not a bunch of hoses to deal with. And you
Right.
just get in and zip it up. So that's the number one reason why people love LymphaPress.
Yes.
But wait, there's more. So the LymphaPress offers therapy for multiple conditions and different lifestyles. I love that middle photo because, by the way, we all know now that lipedema does not just affect the lower extremities. We have a jacket that addresses the upper extremities. That middle photo, you can see a mom who is having breast cancer, had breast cancer surgery, then developed lymphedema, and she's wearing our comfy sleeve, which actually compresses under the arm, the axilla area, in a way that's unique. It's really effective therapy. And so, it's one thing to get a breast cancer diagnosis and then to find out you have lymphedema. Gosh, we're so grateful to help patients with multiple conditions and different lifestyles, whether you have lymphedema, chronic venous insufficiency, wounds, lipedema, which is a lot of our focus today. And you can see Angela there. It's a better photo on the left where she is just putting out her pantsuit and then she can just slide in. The other thing is lifestyle. Okay, you don't want to have to drop everything and do your therapy. You want to be able to do other stuff. So you can be playing words with friends on your phone, reading a book, working on your laptop while you're getting the therapy you need. I love that. So
Yes.
yeah, therapy for now. You teased it. Gail's in the background. She's the little elf making the slides work.
Yes. Thank you, Gail.
She teased the next one. So let's go there. You probably all know Sean Mulroney. So here's the thing. It's hard enough to deal with a condition that affects your body. And then to not be able to have a product that can address your need because of your size. I'm sorry, that just does not work. And that's why the LymphaPress has different sizing options, and you can get expanders for the LymphaPants, but the LymphaPod is amazing for people who are over 300, 400, even 500 pounds. Sean Mulroney is in charge of the obesity revolution. And I know he's been involved with your events in the past. He had a vision board, and on his vision board was a LymphaPod. And he said, one of these days I'm going to have one. Well, Sean has his LymphaPod. He says it's a game changer. And he absolutely loves it. You'll often see him posting things. And by the way, a lot of the slides you're seeing are actually related to videos. So if you go to lymphapress.com and you go to our Engage page, you'll see all the interviews we've done with these amazing people. So yeah, size matters because you want a garment that will be comfortable for you to get into. And we've got a garment for every size individual, which is a source of comfort for the patients that we work with. And I know that I'm not letting you even get a word in edgewise, Leslyn. So feel free to jump in there, but we can move slides forward to Gail if you'd like
Yeah.
to,
And
because
I
we've
just want
got
to
more
point
to
out
talk
that
about.
for lipedema, especially, that we really want to address that trunk. And I just felt like uh, LymphaPress has addressed the trunk in the best way possible. So I really recommend that for my patients that need that trunk to be addressed.
Yeah.
And we really need to be addressed for people with lipedema.
Yeah. Oh, it's so true. And it produces results. I mean, there is one woman on our website. You'll see her if you just put in the search bar, Kelly Maynard. So LymphaPress produces results. This is a woman I absolutely love, Carol Moody, and
Yes.
we have a video of her on our website where she had amazing results with her LymphaPress. And for lipedema as well, Kelly Maynard, I think within a month, lost lots of inches. She began to sweat again, which is an indicator that things were not getting trapped. Things were starting to move again, which is really a sign of health.
Mhm.
And she was able to wear her wedding ring again, which is
Mhm.
awesome. I mean,
Mhm.
things like that that improve your quality of life. Why bother being compliant with something if it's not going to yield results? And we know that if you use it, you're going to have results and you're going to have an improved life. So Carol Moody is just one example. I know she attends a lot of your events as well. And I'm so
Yes.
glad you mentioned the abdomen because, when you go to your doctor, so there used to be a day where you would just go to the doctor and take whatever they said and do whatever they said. And I think that's wonderful, except we are in an era of patients advocating for themselves.
Mhm.
So I always recommend make sure you ask for LymphaPress by name. And if you have lipedema and you are prescribed the leg sleeves, at least inquire about getting the Lympha pants. The Lympha pants are so effective. We
Mhm.
are in network with most insurances. When you talk about the Optimal Plus, which is the top of the line, and the Lympha pants, candidly, there will likely be a copay, but we have no interest payment plans available.
Mhm.
And we will work with you. And there is usually a large degree that the insurance companies will pay for,
Yes.
minimizing your out of pocket. So, don't just talk yourself out of it and say, oh, I can't have this. You're worth it. You
Mhm.
are worth taking
Yes.
care of yourself and having an improved quality of life. So that's number
Right.
3. LymphaPress produces results.
Yes. And it definitely makes it worth it. And as Brenda already said, multitask. You're not just taking an hour out of your time just to pump. You are perfectly able to do other activities at the same time. Visit
Yeah.
with your grandchildren, watch your favorite TV show, sit with a nice cup of tea and read your favorite Jane Austen novel. There is
Mm.
lots you can do while you're in your pump.
While you're in your pump. Absolutely. So let's go to number 4, Gail, because, I do want to say that we had other results with that Center for Opinion because we wanted it to be a statistically valid survey, not just, a bunch of numbers we pulled together for marketing, right? 83% of patients who used the LymphaPress said it improved their condition. 94% said that they would recommend it to another patient. 88%, like I said that it was easy to use. And
Mhm.
I love that photo of the woman on the right because she's getting back to living.
Mhm.
You can be immobilized by your condition,
Mhm.
but using the LymphaPress will help you get mobile again. So let's keep going, Gail, because I know my time is limited.
And
Number
I want to
4.
just say, I'll interject one thing in there because I know another person who does a lot with Lympha Press, Kelly Bell. He specifically says that he was a spectator and now he's back to being a participant in his life again. And using the Lympha Press pump is part of being able to participate in life again.
Yes, that's what it's all about. We want people to live with their condition, not suffer with their
Mhm.
condition. That's the distinguishing factor. So It's easy to clean. Not all pumps are created the same way. They're not made of the same material. And what I love about the Lympha Press, it is so easy to clean because I have been known, I'm always going to my dry cleaner every week. Got another stain, always spilling my coffee, always getting, wherever I've been, you can see it usually on my clothes because I end up wearing it. And so the same with the Lympha Press too. You want to be able to clean it. And some patients with lymphedema have wounds. There can be oozing. You want, and especially in our world today, everything to be able to be sanitized easily, right? So the material that the Lympha Press is made out of, you can just wipe it right down, take one of your cloth wipes or a little bit of sanitizer, boom, boom, done, clean, easy to clean. But can I just tell you, number 5 is my favorite reason? Because we, like I said, don't just give you a pump. We engage with the community in a lot of different ways. Now, the QR code you're seeing there won't work because of the slide the way it is. However, we have a link tree that gives you access to everything. We do monthly webinars with thought leaders in the space, everybody who really, the authors of the standard of care for lipedema in the United States, people who are on the cutting edge of research. So you can register for those roundtables, for those webinars. But every month, the third Wednesday of every month, and I know you've been to our roundtables, Leslyn, we have top social influencers, top medical minds joining in. Chat is hot. The live event is awesome. It's at 8 p.m. Eastern Standard Time, 5 p.m. Pacific Time, the third Wednesday of every month. If you follow that link tree for Lympha Press, you can register for it. The second Tuesday of every month, we have a lymphedema patient roundtable. So we're covering both the lymphedema and the lipedema populations. We also do one-on-one interviews with people just like you. If you are watching and you think, oh, I feel all alone, the whole point is we don't want you to feel alone. What Leslyn and Catherine Seo do with their wonderful organization is to make sure that you don't feel alone. And Lympha Press, as a partner, wants you to also know that you are part of a community. There's a lot of inspiration. There are people that show up to our lipedema roundtable who don't have lipedema, but say it's so darn inspiring that I just want to show up every month. We had Bill Rapisi from Learn with us last Wednesday. We often have special guests. Leslyn, you need to come and be a guest panelist on our lipedema patient roundtable. It's awesome.
Sure.
Please
Yes.
do engage with us because, again, you'll get your pump. You'll get your Lympha Press, but then you're not alone. We will walk with you. We will answer your questions. We'll link arms with you. We want you to be a success. And that's what makes Lympha Press different. And so I'm so glad that I had a chance to be live with you today to talk about therapy that's easy to live with. Go visit lymphapress.com, come to a roundtable, engage with us, and know that we are proud to support you and to support what you're doing, Leslyn and Catherine. And it's a great teamwork, really does make the dream work, right?
Yes. And we do have a couple of questions in the comments here. Gail, if you could put up the one from Mary, I think was the first one. And she says she has a Lympha Press and she uses it twice a day without fail. And here's her question, Brenda, if you can address that for Mary.
I don't see the question.
Oh,
here
you
it is.
don't? Okay, I'll read it.
Oh, how hard is it to get the
Yes.
pantsuit after having the legs? I was originally ordered the pantsuit, but at the time couldn't tolerate. Okay. So close to 3 years. Now, with insurances, particularly Medicare, every 5 years, everything resets. So you could do that. I would talk to your insurance company, tell them that your condition has improved to the point where a different model may be beneficial to you. Having a dialogue is just so important. First of all, Mary, I'm so glad that you have the Lympha Press. That's amazing. I would also reach out to your local representative. We are not just a company that's, online. We have human beings that are out there serving our patients, and our local representatives have relationships with your doctor's offices, and our inside offices have relationships with the insurance companies, and we're a team together. So what I always say is it can't hurt to ask, right? And we will go to bat for you. Our team, our inside team knows that you're not just a name on a file. You're a patient that deserves to be advocated for. So we'll do whatever we can to help and get you the pantsuit. And I'm glad you listened to your body, because if you weren't tolerating the pantsuit to start with,
Right.
then that was the best thing you ever did, which was go to something that could be tolerated.
Right.
But the thing is, you're getting better.
Yeah.
You're getting better. And so that's the end goal, which means that you can grow with another Lympha Press product, and the therapy will grow with you. You know, one thing I didn't mention is the boots, all the garments they fill to fit you. So as you reduce, the air surrounding your extremity will just increase so that you'll still get that snug fit. It's not like when you buy kids' clothes and within 6 months they've outgrown them. The therapy will grow and improve with you as you use your pump. And I am rooting for you, Mary, to get the Lympha Pants.
Yeah. And I will say that your certified lymphedema therapist is going to be your best friend in this process, because many physicians, although wanting to be helpful and refer you for getting the products that you need, a lot of times your certified lymphedema therapist will know more about it than your physician, but your physician knows more about your medical condition and whether or not you can tolerate maybe having something up to your waist. And it was good that you moved to something less with less coverage until you built up your tolerance. So really bring that lymphedema therapist on the team to work with you and your doctor to make sure that you get the best thing for you. It's sometimes can be a complicated process. So use your lymphedema therapist to help you.
Absolutely. And they are wonderful at taking notes. Notes and documentation are so important. And working in concert with your doctor, getting those notes, documenting everything, that is so important when you're going and talking to the insurance companies. Thanks for the question, Mary. We appreciate it.
And Francine's is kind of a nice follow-up to that one, because she's talking about really is not being able to tolerate both legs at the same time. Sometimes we cannot, the Lympha Press works so well, sometimes it overwhelms our system to have that much fluid moved. And so we can't have as much coverage as maybe we will ultimately need. So can you speak to Francine's question?
Thank you, Francine, for the question. She wants to know if you can just use one side at a time. And while we were the leaders in bilateral therapy, because back in the day with pumps, you could only do one leg at a time. And many conditions are bilateral. Now, Francine, I'm not sure if you're using the Lympha Press, because you can also adjust pressures in a way that may make it quite tolerable for you to do bilateral therapy. However, if you see our Optimal Plus, you'll see there's just two things that you plug in. One for one left side, one for the right side. And so you could unplug and put a blocker in one of the sides so that you're just doing unilateral therapy. However, I wouldn't come up with that solution by yourself. I'd want you to work with your lymphedema therapist or your medical professional to make sure that it's the right thing for your body. But it does lead me to say that another difference about Lympha Press is how you can adjust pressures.
Yes.
And for people with fibrosis, and when we talk to people like Karen Ashforth, who is an expert in fibrosis, the higher pressures are necessary in order to really get in there and make an impact. But in other cases, a lighter pressure. And the Optimal Plus also has both sequential and peristaltic modes. So there's different approaches to the therapy. And maybe it's not so much doing unilateral, but maybe a different kind of therapy or a different pressure that might be the result you're looking for, Francine. But Francine, we love the question. And thank you so much for asking.
Yeah. And so it shows you that there's so many different options, finding the one that's right for you. It really takes, to have your team helping you to make those choices and to guide your treatment. This is a medical treatment, and it's done with a prescription. So it's not just something that you buy on the internet and then you do on your own. This is a medical product, and we do this as a team to help you make sure that you're doing this in the most safe and the most effective manner.
I see Nancy's question, and she is in Canada. Nancy, thank you so much for joining us today, and we appreciate you. She had a LymphaPress, loved it. It actually got lost when she was moving, and the insurance didn't cover the loss. So that is a loss. She's saying it's not available in Canada any longer. We are an international company. I think we are in 37 different nations. And while I can't say definitively yes or no to your Canada question, I would love for you to reach out to marketing@lymphapress.com, because we can connect you to our international office, and perhaps we can help in some way. We really want to. This is a great takeaway from today's live, which is don't just take no for an answer. Advocate for yourself. Continue to ask the questions. You never know if you don't try, and we would love to have the opportunity to get you in a LymphaPress again, Nancy.
Seek help. You don't have to advocate for yourself on your own. We're willing to help you. So, seek help. Send that email, and don't try to do this on your own. Sometimes it's hard to advocate for yourself when you're not feeling well. So we're here to help you. And I see that, Gail, you put up another question there we had.
I love this question. Lori Rotella, you want to know, how long does the LymphaPress last? Well, I have to tell you that, as I mentioned, insurance usually every 5 years will fund another device. However, I've been with LymphaPress for over 10 years, and there are some people when I joined the company that got their LymphaPress, and it's still going strong. So it's exciting, and we are continually developing new technologies. We're listening to patients and doctors to be on the cutting edge of what pneumatic compression therapy can be. But it's a workhorse, and a lot of people travel with their LymphaPress. They wouldn't leave home without it because it's not sensitive to travel. It can go right in your suitcase, schlep it along with you, and it will be in with you for the long haul. So I would recommend, and it also has, and I don't know offhand, but there is a robust warranty period as well. So no worries there. It's not going to be skittish on you.
Yeah, I definitely have patients who travel with their LymphaPress and just put it into a small carry-on bag, rollable, and then take it on that way with their flight, check their other bags. And now it's such a wonderful thing to have once you arrive at your destination, be able to do that.
Especially travel tends to create a fluid situation. So to be able to go back to your hotel room and just pump it out and then keep going to help you enjoy your vacation or your work travel or whatever you're doing. I love that. I love this question too. So Liz and Brendan McGuire, I bet that's Liz McGuire. Lizzie McGuire, did you ever get teased about that? Because that was a show back in the day. She does not have a bed. She sleeps on a recliner. My mom always slept on a recliner too. Absolutely. You can definitely use the LymphaPress on a recliner. And you know what? It's easy to use no matter if you're using it on a couch or a bed or a recliner, and you're going to figure out what works best for you. Angela felt it was easier to just lay it out. You could put it on your recliner and shimmy in from the side and then do the recline. So then you can zip it up. It's like putting on pants or a jacket. It's that simple, and it doesn't matter where you use it, but you do need to be in a position. You can't be in an up position when you're using
completely sitting up. Yes.
Right, especially since it's going to fill with air up through your abdomen. So you cannot be in a seated position. That's the only thing.
Yes. Yeah. Thank you so much. And looks like we have another question. I'm not sure how to say the name, but
Meemaw. I bet it's a grandma name. Meemaw G. I used to have friends that called their grandmother Meemaw. So I hope
okay,
I have not
okay,
offended you, Meemaw, but that's what my guess is.
okay. And what field of medicine can guide and help with the diagnosis and therapies?
Well, you know that your website is a wonderful clearinghouse for doctors located in every city. And you just put in your zip code and you can see who treats lipedema in your area. The other thing is, feel free to reach out to marketing@lymphapress.com. We will get your zip code and we will connect you to the doctors that we are working with in your area. So
Right.
either way, we got you covered. Don't sit around and wonder if I can get a diagnosis or if I can get a prescription. Take some action, contact marketing@lymphapress.com or go to the website for Lipedema Simplified and get connected, because that's where your journey to getting better will really begin.
And it could be your GP, your family doctor is aware enough. It might be that you get referred to a vascular specialist. Sometimes we use surgeons who do liposuction surgery, so plastic surgeons, if they understand lipedema and lymphedema, that might be someone. But I definitely would start with your personal physician, your GP, and ask for help there, and also the resources that Brenda said to find, the medical providers that know what lipedema and lymphedema is a good place to start.
Yes, because then you don't have the learning curve.
Right.
So many
Right.
patients are walking into their doctors and having to educate them about what lipedema is. So I'm all about the fast track. If you
Mhm.
can get with somebody who already understands, knows, has diagnosed it, and can get you the help you need quicker, that's what I'm all for.
And speaking about learning more about lipedema and lymphedema, we are having our event, our virtual event that's happening March 31, April 1 and 2, fresh take on lipedema and lymphedema solutions. And it is a big community event that's happening in about a week and a half. Be sure and join us for that. We'll give you a link in the comments to find out more. Lympha Press is one of our sponsors for the event. And also to find out more about the event and just questions in general about lipedema and lymphedema, be sure and join us for our special Q&A that we're having about anything to do with lipedema and lymphedema. And that's going to be happening this Saturday at 4 p.m. Eastern time. And so more information in the comments about that as well for you to get information and to register and join us. Brenda, so wonderful being here with you today. I always enjoy
I
seeing you.
loved it. I loved it. And I love your community, and Lympha Press loves lipedema patients. We just consider it a privilege to partner with you to sponsor the work that you're doing. And every time I meet one of those amazing women out there, or they join a round table and, we hear their stories, it's inspiring. So thank you for the privilege of being with you today.
Thank you, Brenda. See everybody next time. Bye-bye.